think the number one reason why I chose Tufts Residency was because of the people that I'd be working with and the people that I'd be taking care of. I knew that coming to Tufts as an intern, I'd have a lot of my inpatient rotations very front-loaded, which was exciting and a challenge, but I knew that coming here I would have the proper support from the residents and from the attendings, and I knew that be like on a texting basis with some of the attendings, so I knew there was that support and collaboration. And then I knew that the patient population was very diverse.
You know, it's a small program, everybody knows each other. You know the fellows, you text the fellows, you text the attendings. Dedicated apps for that now, but the communication's easy. I felt a good connection too on interview day, of course, which everyone says is the most important thing, so.
We work a lot of hours, as any resident does, but I feel like when I come here, a lot of times I come home to my family, so I don't feel like I'm coming to work, but I feel like I'm coming to a safe space where I can work with everyone and everyone is really loving of each other.
I feel like everyone's going to say the people, and am I right? Everyone, okay, so I would say the people, like 1,000%. Everyone that I've ever met or worked with has just been absolutely phenomenal. Seriously, from co-residents to residents over in other subspecialties, to the nursing staff, case managers, social workers, nutritionists, the other attendings, like everyone is just so incredible here, and everyone just enjoys working with each other, and yeah, I would have to say the people, absolute no-brainer.
I really kind of grew to understand that, you know, if I wanted to learn a subspecialty, which is what I'm interested in, you know, I really need to do that with the people that specialize in that. And there's, you know, something that they, you know, they know more about the subspecialties. They know more about, you know, the specific kind of disease processes and stuff that, you know, a generalist may kind of hit the surface of, but you know, a true specialist really knows intimately.
So Tufts, you know, it's a unique appeal, a small program, very close-knit subspecialty service in one of the best cities in the world, here in Boston. So it's great clinical training in a city that I always wanted to be in, learning from some of the leading experts in their fields, and so it's a special place to be.
I think that at Tufts, we take our human resources, which are of two types. One is our faculty, and one is our patient population. And I think that we put them in front of you as a trainee or our trainees in a way that allows you to develop individually, but to kind of the highest level that you can as a clinician. We have a very complex patient population here. They're very acute. We have a lot of illness. You will see a lot of patients in your training here. And I firmly believe that kind of the more you see, the more experience you get, the better you are at the job.